Good afternoon, everyone. Thank you for joining us on today's webinar on understanding hormonal health and well-being for women. As we celebrate Women's Day tomorrow, this session is dedicated to empowering women with knowledge about hormonal health and its impact on overall well-being. Hormones play a crucial role in regulating various bodily functions, and its imbalances can lead to conditions such as thyroid disorders, PCOD, menopause related changes, diabetes, and osteoporosis. Today, we will explore these common hormonal disorders, their symptoms, and effective management strategies, including lifestyle interventions for better hormonal balance. We are honored to have Dr. Monika Sharma, a leading endocrinologist with over 16 years of experience in medicine and 10 years specializing in endocrinology. With her extensive expertise in managing diabetes, thyroid disorders, PCOD, and other endocrine conditions, she will share valuable insights to help us better understand and take control of our hormonal health. Everybody, in the end, we will have some 10 to 15 minutes for any questions that you may have, so you can just hold on to them, and once the Q&A session is open, you can start putting them on the chat. All right, so let's get started. Over to you, Dr. Monica.
Thank you all. Thank you for inviting me. And let me just put on my presentation. So I hope I'm audible.
Yes, you are.
Okay. Okay, thank you. So we'll be discussing some very basic things about hormones. Okay. Ma'am had already given us a very thorough overview of the presentations and what all topics I hope to touch with this presentation. So first of all, what exactly is a hormone? There is a very specific thing that a hormone does, and that it is made from a cell somewhere in the body, and it travels through blood to different organs, and there are certain receptors on these organs, and it acts only on these hormone receptors, and then it brings about changes. So anything traveling by blood to the effector cell is a hormone. So there are lots of hormones in the body, lots of hormones that we didn't even know were hormones have turned out to be hormones. Like vitamin D, for instance, lots of us, for years and years, we thought that vitamin D really was a vitamin, but now it's coming that it acts more like a hormone than anything else. It's made by a body, it's made by our skin in presence of sunlight. It travels into the blood with the help of a vitamin D binding protein, and then it acts on specific cells. So even the definition has expanded to include even things like vitamins. So what all these hormones do, they help in maintaining the body, they help in maintaining body homeostasis. Homeostasis means ideal good functioning of the human body. That is what we call as homeostasis. So this is what a hormone is and how it acts. So these essentially take messages from your bodies, the well-being of your body, transmit it to the brain, the effector molecules, and then the brain responds by secreting hormones or reducing the secretion of some hormones or by balancing them. So that affects almost all things in our body, from growth in children to maturation of children, including the pubertal changes, to your normal growth and functioning, your hair growth, your intestine functioning, your heart rate. All of them are at some point governed by hormones. Even a hormone plays a major role in conceiving, in pregnancy, after menopause. All of the roles are played by hormones, and it helps in maintaining the body from birth to death. What are the examples of body hormone? Lots of them. So we know, I'm sure you're familiar with some of them, the most common ones causing the most common problems. So endocrine disorders are increasing in their prevalence. We are seeing more and more endocrine disorders now. Thyroid is one of the most common endocrine disorders, and the thyroid hormone fluctuations. Thyroid is, as you can see that here, that is a small butterfly shaped gland right in front of our food or windpipe. Apart from thyroid, diabetes, which occurs not just because of the reduction in insulin, but also because of insulin resistance, is secreted by pancreas. Apart from them, certain lesser known hormones that can cause major problems are the gonads, the adrenals. They are located just on top of your kidney, and they regulate the most important life-saving hormone of the body called cortisol. Then certain other hormones are involved in childbearing, in breastfeeding, in bone metabolism. There is also a master gland that is present just below our brain called the pituitary gland, that makes multiple hormones, 4 or 5 hormones that regulate growth, that regulate reproduction, that regulate menstruation, our thirst. So you can see that lot of hormones are involved in a lot of things, starting from your when you wake up till the time you sleep. So why women's hormones? Both the sexes, the hormones are different. They have a different impact. Certain disorders are much more common in women than in men. Certain hormonal disorders are also more common in men than in women. But yes, we do need to place special attention to the women's hormones, just because they change a lot. They change a lot, and hormones, especially the female hormones like estrogen and progesterone, they have a direct impact on your body's immunity, on your body's working, and they also have an impact on the other hormones as well. So we see that multiple endocrine diseases certainly show up after or during pregnancy or in the postpartum period. Women start losing hair, they start developing thyroid problems. This is because hormones also interact with each other. So we come to we'll go through some of these hormones topic wise. So thyroid is one of the most common endocrine disorders in women. It's especially more common in women when compared to men. Almost, I would say 5% of the world population, that is in 100 women, 5 women will have some or the other thyroid disorder. The most common one being thyroiditis or subclinical hypothyroidism, where the thyroid is just a bit underactive. That means that the thyroid is not making enough thyroid hormone to sufficiently satisfy your body's need. So when that happens, your brain responds by increasing the thyroid stimulating hormone or TSH. So a high TSH actually means that you have an underactive thyroid. Likewise, a low TSH will imply that you have an overactive thyroid. Now, when thyroid becomes underactive, that generally means is that your body is not able to satisfy the thyroid hormone requirement, because thyroid hormone is required in lots of tissues from your tip to toe. So it's required for the bone maturation. It's required for children's brain development. It is required from the nervous development of the children. It's the essential hormone that determines your baby's intelligence. It also has multiple roles throughout the adult body. It maintains our hair growth. It maintains the skin, the how much nourishment our skin will get, the thickness of the skin, the rate of growth of the nails, the how much heart rate your body will have, how slow or fast your intestines will act, your menstruation. Lots of things are governed by thyroid. So the symptoms obviously are very, very vague. Patients can have thyroid for years without even noticing that they've been having these symptoms because of thyroid. They think that this is just a part of life, that you're always fatigued, you're always having muscle pain. So do get your thyroid checked, especially at the change in transition, such as during puberty. Certain women develop hypothyroidism. After 16, 17 years, we see that the patient complain with heavy menses, and then we check there is hypothyroidism. Before planning pregnancy or after pregnancy, even during pregnancy, certain women they develop hypothyroidism. Menopause is another age wherein the patients often develop thyroid abnormalities, because there is an immune shift, there is an immune change. So treatment is clearly straightforward and simple. Once your body stops making the thyroid hormone, there is no way really for it to grow back this ability to make thyroid hormone again. So we have to supplement it from outside, and luckily there is a simple pill available that you can take every day, and that takes care of the hormone meals. It's orally absorbable. It is a very good bioavailability. Once you take it, almost 90-95% of it is absorbed. But yes, you should take your pill always empty stomach without anything else, and you should preferably remain empty stomach for at least 30 to 45 minutes after taking the medication. Some acidity is required for thyroid medicine to get digested. So it's better that you take your acidity medication or acid medications just before breakfast, or at least half an hour gap after your thyroid medication. So likewise, hyperthyroidism, exactly the opposite. It has a hyperactive thyroid gland. Causes can be multiple, and you need a doctor's checking as well as evaluation. He or she will check you for thyroid inflammation, any autoimmunity that you might be having, and even a functioning tumor of the thyroid can present as hyperthyroidism. So management is usually medical. This is not as easy to treat as hypothyroidism because this is an overactive thyroid and needs active management and care. Medication includes medication that is anti-thyroid drugs that stops the production of thyroid. It can also require radiation if the medical therapy is not really effective or it doesn't suit you. And in rare cases, even surgery may be required in these cases. Symptoms are pretty distressing, and these patients often they seek help earlier because of the distressing symptoms. They have weight loss. This is despite eating more than usual. So even though they're eating more, they're not really able to use those calories. They feel hot all the time. They have palpitations or high heart rate. They have emotional issues. They have emotional lability. Since their intestinal motility increases, they can have loose motions. They can also have menstrual irregularity and recurrent pregnancy losses as well. Elder patient can also have a loss of their bone strength leading to fractures. So these hyperthyroid symptoms, they're actively picked up, and not all of them might require treatment, but most of them do, and the treatment is variable and needs expertise to manage. So lots of difference in one. If one feels cold, there is a puffiness of the face, especially beneath the eye. There is a reduction in heart rate. You might not have all of these symptoms. The more common symptoms that we see is maybe a 2 to 3 kg of weight gain, and the weight is usually water weight because of the retention in the skin of water. There is constipation. There is heavy menses that patient can experience. There might be hair loss. There might be a slight bulge in the neck in the form of goiter. Patient can also have a mental fog or for forgetting to have any new memories. They often forget things quickly, especially things like what they ate in the morning, where did they keep their keys in the morning. So these kind of long-term memory is not affected, but yes, short-term memory definitely is. In case of hyperthyroidism, patient can have quite the opposite symptoms. He or she can have, a feeling heat or hot all the time. Patient can have weight loss, diarrhea, palpitations, or uncomfortably being aware of one's heartbeat all the time. Patient can also have infertility, and they might also be having some bulging eyes like features. Hair loss can be present in both of them, and goiter can also enlarged thyroid gland that can also be present in both of them. So, is there any specific diet that we should have for thyroid? Not really. The cause of thyroid used to be dietary. Till the 1970s, I would say 60 to 70% of thyroid was diet induced, because we did not simply have enough iodine in our diet, and patients who had goiter often had iodine deficiency as the underlying cause. So treatment was pretty straightforward, and treatment has been done for all the Indian population by adding salt in the by adding iodine in the salt. So that took care of this problem. So now most of the thyroid problems that we see is not diet related. It is related to just the autoimmunity, or the what we call as Hashimoto thyroiditis, wherein the body recognizes the thyroid as something that is foreign and needs to be attacked. So diet right now it's not much use, but yes, you should continue the consumption of iodinated salt. Iodinated salt is there's a basic premise that it should have at least 20 part per million uh, uh, of iodine when it reaches your doorstep. Foods that are high in trace micronutrients can help a little bit because they're also used in making thyroid hormone. These foods include beans, bananas, whole wheat, mushrooms. These foods are rich in selenium, that is helpful. Whole grain nuts and oranges are rich in chromium, that might be useful. And maintaining a good iron intake by taking iodized salt or fish if you're a non-vegetarian can help. But as such, no. Only diet cannot cure the thyroid that we are seeing in our practice right now today. It used to be an iodine deficiency thyroid, wherein most of our thyroid hormone is made up of iodine. So 4 iodine molecules are required per thyroid hormone molecule. So that was required. And once you didn't have iodine, you didn't have thyroid. But now what causing thyroid, it's the autoimmunity, and for that there is no medical cure as well, and no dietary cure as well. You do need to take medication as much as possible, follow the medication, and with medication the quality of life is pretty good, and patients often can have healthy life, healthy pregnancies, healthy deliveries, even with the disease. So now we come to another one of our most commonly seen hormone disorders that we are seeing, PCOD. Now this is a relatively new disease in that it wasn't really in existed up to 200 years ago. It's more common in women with childbearing age from 15 to 51 years, but it can happen earlier as or later as well. Patients usually come to us with infrequent menses, like often they have less than 9 menses per year. They have a hormonal imbalance in the form of a variation in the amount of testosterone and estrogen, with an excess hair growth that can be seen on their face and body. The hair is different, it's more thicker, it's more coarser, it's darker. Patient can also have signs and symptoms of insulin resistance. They can have blackening on the side of their faces or on the back of their necks, or in the groin area, or in the flexural folds area. In addition to that, when we get an ultrasound done, we can see tiny cyst-like things in the ovaries. So approximately at least 12 cysts should be present to mark it as PCOD. Along with that, other things like increased ovarian volume, ovary becomes larger in size because of these cysts. These cysts can only be appreciated on ultrasound, but yes, you can even have PCOD without the presence of the cyst as well. So it is related to weight gain, it is related to a sedentary lifestyle, it is related to obesity and a family history of diabetes as well. In long term, there is an increased risk of infertility in these patients. In long term, there is also an increased risk of endometrial or uterine cancer in these patients. So treatment usually involves first lifestyle modification, or in some cases a long course of hormonal therapy can also be given around 9 to 12 months, and in some cases up to 2 years of hormone therapy to correct the underlying abnormalities. However, the cure is of PCOD is still not around. It is a lifestyle disease. It really helps to be losing weight to reduce the insulin resistance. Dietary changes need to be very strict and followed. And yes, PCOD is a lifestyle disease. So definitely diet helps in that. Diet, what does diet usually mean? It means avoidance of simple carbohydrate. Simple carbohydrate means avoiding sugar, avoiding fruit juice, avoiding these carbonated soft drinks like Coca-Cola, Miranda, and all of these, carbonated soft drinks which have a high calorie content. Avoiding any this super fine flour or maida containing foodstuffs like biscuits, cakes, bakery items. All this also helps. Increase your diet, a Mediterranean diet with increase in the medium chain fatty acid. Like you can have oils, you can have cheese, you can have paneers, you can have beans, whole wheat. All of that you can take, but you reduce the consumption of the simple carbohydrate like sugar, uh, jaggery, etc. So, treatment mostly involves lifestyle modification along with a combination of the medication. Really depends on the patient profile. If the patient wants to conceive, the medication is different. The patient is more worried about the hair on his or her, on her face, then the medication is different. The patient has irregular menses primarily, then the treatment will be different. Well-educated, thought-out plan with your doctor will really help in tackling PCOD. So next we come to menopause. So menopause is a period of transition wherein the body stops producing estrogen that is made by the ovaries, and is defined as 1 year after the final menstrual period. Usually the age is around 51 years. It can be earlier in Indian patients, and the date will most likely coincide with your mother's menopause age as well. So the symptoms of estrogen deficiency, suddenly your body that's been swimming in estrogen since the age of 14, 15 years, suddenly it has to get used to not having that much estrogen in your blood. So what happens is you develop hot flashes, that is a temperature irregularity. You start feeling hot all of the time. There is sleep disturbances. Patients can often have long-term insomnia. Estrogen is a bone forming hormone. It helps in making new bone. So sudden withdrawal of that estrogen often leads to bone loss. In severe cases, you can also have fractures. Estrogen also protects the bone. So there is an increased risk of cardiac events, in that your cardiac health becomes like a man's after the menopause. And so you do need to take care of your regular hormone lifestyle checkup. So it's usually managed by lifestyle measures. Hormone replacement therapy can also be given, but only in very severe cases. We try to avoid as much as possible, because hormone therapy long time after menopause is not really safe. We do have weight management, that suddenly you might have an increase in weight after menopause. Yeah. A good protein rich diet, low fat diet. You should have a regular cardiac checkup, BP monitoring, blood sugar, cholesterol, and your bone mineral density you should get it checked after menopause, or at least after you're 60. So sometimes the postmenopausal syndrome has severe symptomatic side effects. You can have severe changes in menopause that can affect the quality of life. Like you can have hot flashes, you can have reduced sleep. Someone can have mood disorders. So all of them need specific treatment, and treatment options are limited, but they are available for most. Usually, we give hormone replacement therapy till about 5 years after menopause, and we stop it after 5 years because it's been linked to certain increase in the cardiovascular events. There is a certain checklist of diseases that you should not be having once before initiating HRT, and you can discuss with your doctor regarding that. So now, most common disease that we see now in our OPT is diabetes. Even I think the age group has also shifted from what we used to see in the 50s or late 50s, development of diabetes, to now even early 30s. We are seeing that diabetes has become more and more common because patients are usually sedentary and they are doing their desk job. They are having high screen time. In addition to them, most of them are having a poor lifestyle. Most of them have a family history of someone in the family having type 2 diabetes. So all this can lead to development of early onset of diabetes. So when should you be worried? You should be worried if you are a high risk case, like you have a family history, someone who's a first degree relative that has diabetes. That includes your father, your mother, or your either sibling. Second degree relative also, you should get it checked. If you are overweight or obese, especially someone with a BMI more than 25, so the way to calculate your BMI is divide your weight in kg by your height in meter square, and multiply again by your height. So that is how you calculate your BMI. There are multiple calculators also available online. If the BMI is more than 25, then you have a high risk of developing diabetes, being an Indian. In case you have a sedentary lifestyle, if you're sitting for more than 8 hours at a stretch, if you have a history of gestational diabetes, or if you're having a large weight baby, and that delivery of a baby more than 4 kg in size, or if you have PCOD, then there is an increased risk of diabetes as well. What are the lifestyle measures that you can have to mitigate? Reduce the intake of simple carbs, same as PCOD, superfine flour, sugary fruit juice, all of them should be avoided. Include more of multigrain food in your diet. There should be a good protein in your diet as well. And you should switch to a low carb alternative for most of your food stuff. This really helps. Along with that, weight loss, at least 5 to 10% of your weight loss, if possible more, can really help in reversing or stopping your diabetes. Apart from that, regular exercise. If you're out of shape, if you're not really in the habit of regular exercising, then start by walking around 5 to 10 minutes every day, preferably empty stomach if it's possible. Try to set a goal for walking, set up a exercise buddy that you can use to walk with, and you should aim to do this for at least 30 to 5 minutes at least 5 days a week, with not more than 2 days gap in between. Try to avoid sitting for more than 30 minutes at a time. Either you get up, you stretch, you walk, you do some quick exercises, do something. Sedentary lifestyle is the most common cause of diabetes that we're seeing today, and that needs to be avoided. Okay. Next, we come to something that we don't really think much about, but it's really it's really becoming an huge problem for our elderly females. That is known as osteoporosis. So, what osteoporosis really means is, here on the left panel, you can see a healthy bone, and on the right panel, you can see osteoporotic bone. So, basically, what happens is bones develop tiny, tiny holes in them, pores in them, and these make the bone very weak. This happens commonly after menopause and in certain old age men as well, but normally it's seen in females around more than 50 years of age. After menopause, the supportive effect of the female hormones reduce. This results in the bone dissolving into the blood. It presents as fractures. Even at slight trauma, you can have a fracture. What are the lifestyle methods that can be used to mitigate it? Is you achieve your peak bone mass or the maximum strength your bone will have. That happens in the late 20s to early 30s. So this is the time that you really should be working on achieving a good peak bone mass or good bone strength. Good calcium intake. Certain foods have high amount of calcium. We ask the patient to at least have one white thing a day. It can be cheese, it can be paneer, it can be milk or egg. All of them have good amount of calcium, so have some good calcium intake. If you're vegan, there are vegan options available like soya milk, like almond milk. You can have that. The goal should be around 1000 to 1200 milligram of calcium per day. Apart from this, you should be checking your vitamin D, and if the vitamin D level is no matter how much calcium you take, it won't really be getting absorbed. So increase your calcium intake. Resistant or weight training also helps. Even small amount of weight, 2 to 4 kg, lifting them really helps in strengthening the bones. A regular walking, regular physical activity also helps in maintaining the bones. So these are the lifestyle methods that you can use to mitigate or reduce the risk of developing osteoporosis. Once you already are diagnosed with osteoporosis, that is usually done by a DEXA scan, wherein we check the bone mineral density or how much calcium your bones have per gram centimeter square of the area. And then if you are found to have low bone mass or osteoporosis, there are treatment options. There are pills available, there are injections available, there is IV treatment available. Lots of options are available depending upon your preference, what you would like to take. So osteoporosis does need treatment. Otherwise, you can have something we call the fragility fracture, that is developing a fracture even after some minor trauma, like if you're standing and you fall down, even on that small trauma you can have a fracture. So that really impairs the quality of life. Apart from that, the fracture does not heal very well as well, leading sometimes to lifetime disability for the patient. So this is better avoided and better prevented than cured. So always have that in mind for your old patient, for your old females. So next we come to one of the common problems, infertility. In females, that happens because of it is defined as inability to conceive despite trying for at least 1 year. And female factor infertility contributes around 40 to 60%, 30 to 40% is either mixed or male factor infertility. The common causes are PCOS, thyroid disorder, stress, and sometimes even local factors. So treatment depends upon the cause, and you should see your gynecologist regarding that. So with that, I have come to the end of my presentation. So the key take home points from this talk will be that clinically significant hormonal disturbance has little to do with the day-to-day diet. You cannot cure your hormones with your diet. You can cure only your, the surface level neurokines or the surface level happiness can be cured, but not your hormones. healthy diet and exercise still has a role in certain lifestyle diseases like PCOD, obesity, and diabetes, but not much else. And regular health checkup should be done at different stages of life, and it should be as per your current age. You should get your health checkup done. Hormones should be checked as per your symptoms. The good thing about endocrinology is that hormones are usually available to relieve almost all endocrine disorders, and there are treatment options available for almost all the endocrine disorders. Growth hormone deficiency, we have growth hormone. Insulin deficiency, we have insulin. Most hormones have already been purified and are available. So even for obesity, now the injections like hormonal injections have come up that really help in reducing your food intake, increasing the satiety, and helping in weight loss. So medications, they are available to relieve almost all endocrine disorders, and most of the medications luckily have very non-serious side effects, and in some cases no side effects at all. So you should consult your nearby endocrinologist and get a hormone health checkup done. Okay, I think that is the end of my presentation. Thank you. Thank you so much for patient listening. I'm sorry if I was too fast.
Thank you so much, Dr. Monica. Everybody, you can start putting in your questions in the chat. Dr. Monica, I'm going to be picking up the questions that are there in the chat. Okay. So the first one is which says that menses coming, but flow is 2 to 3 days only, not 4 to 5 days. Is it a diet problem or do you have any suggestion?
It could be an anemia problem. So yes, it could be a diet problem. So if it is regular, it means that the hormones are working correctly. But if the flow is reduced or if the amount of blood is reduced, it could simply be an underlying iron deficiency. So you should probably get that checked up.
Got it. Everybody, you can start putting your questions in the chat. Dr. Monica, I have a question.
Yes.
So I heard you say that white food should be taken for the calcium intake that is required, especially during the menopause. Um, are there also supplements that are recommended during that time,
Yes, if
or
you're
does
not
the
able
food?
to see, the calcium intake that we recommend post menopause is around 1500 milligram per day. So if you like a glass of milk, 200 ml of milk will have around say 250 milligram of calcium. So if you're not able to take sufficient calcium, then definitely calcium supplements you should be taking. And in fact, in most post menopausal women, we do give enough calcium supplements, at least 500 milligram per day, so as to just to cover up any day that they might not feel like having milk or not feel like having any white food. Then they can take the vitamin, at least a calcium supplement. In addition to calcium, vitamin D, at least 400 to 800 units per day should be taken. This is in case the patient is not deficient in vitamin D.
Got it. Thank you. ICS, I don't know what you mean by hair loss. Um, so please elaborate, what you've written there. I'm moving on to the next question, which says, how do you manage premenstrual syndromes?
So premenstrual syndrome is not really a hormonal disease as such. It is just that the patients have severe pain, or they have severe mood imbalance prior to menstruation because of the sudden hormonal changes. So we give short-term medication to reduce the congestion. We sometimes give certain painkillers that help that reduce the amount of prostaglandins. These are the main pain causing chemicals that are released that have the effect. So we give prostaglandin blockers for that. We also give antispasmodics. So this is how we manage premenstrual syndrome. Certain patients often develop swelling before the premenstrual syndrome. So appropriate depends upon the patient's symptomatology. These need to be taken only about 2 to 3 days before your expected periods and 3 to 4 days after the onset of your period, not every time.
Got it. What food would you suggest for iron deficiency for good periods? Example would be helpful.
So any iron rich food, iron is present in most of the we know iron rich foods, like we can have this dates have iron, then most green leafy foods like palak and bathua, uh, kale, spinach, all of them have iron. You can also have fruits like apples have iron, you can have that. Plus it's if you are really deficient, what you can do is switch your cookware to a cast iron one, like a traditional cast iron cookware that leaches some iron in the food. Only caveat, but it cannot be used to cook acidic food because it gets rusted. So non-tomato curries can easily be cooked in a cast iron food cookware, and you can use that. That is what we suggest. Then certain good would be like pomegranate, like beetroot, then radish. All of them have good amount of iron. That all you can take.
Got it. Got it. The next question is, what foods do we have to take for increasing the period flow?
And no, you see, everybody's body is different, and your white body might just be needing that much endometrial lining to shed. So there is no medication that is required for increasing period flow. Yes, but yes, if there is a change that you used to have heavy period and now suddenly you're having low period, then that definitely needs evaluation. The endometrial lining that is shed during the menses is made from estrogen, and the shedding off is done by progesterone. So these two hormones are mainly involved in maintaining period flow. So any imbalance in them, that can lead to a variation in period flow. So if there is a change in what it used to be and suddenly now it has changed, then that needs evaluation. But yes, sometimes your body will only have enough lining made to shed for 3 days. That's not a problem.
Got it. And I believe if somebody is asking what foods to have for increasing the period flow, then probably that would be the iron-rich food that you mentioned earlier.
Yes, definitely. If the iron deficiency is the cause, then you can have iron rich food.
Got it. The next question is how to control hair loss problem. Is it related to diet or need any health checkup?
Yes, it does need health checkup because hair loss is simply a symptom. It's your body telling that something is not right. Now, hair loss is a very broad term. It can have multiple causes. It can be because of nutrient deficiency, iron deficiency, B12 deficiency, vitamin D deficiency can cause hair loss, or it can be simply that your hair have become very brittle. That is causing the hair loss. That is because of protein deficiency, so that a dermatologist will check. Or certain local scalp problems like dandruff, like seborrheic dermatitis, that can cause hair fall. That is because of the fungal infection, so that needs a different sort of treatment. Apart from that, yes, hormone disorders like thyroid, like estrogen deficiency, we see postpartum suddenly lots of hair. That is because your body was used to so much estrogen. Now suddenly estrogen has come down, so your hair starts shedding all of a sudden. In addition to that, there is something that is most commonly seen in females, telogen effluvium. It happens after a severe sick illness. You're sick for a time, like you have a flu or something. After that, your body goes into a stress response, and after stress response, it loses the hair because it is dispensable. So during recovery of illness also, we see some hair fall. But in most cases, if you don't have a family history of that, female hair loss is pretty resilient and it does come back easily. But yes, the cause varies. It depends. So you can either see a dermatologist or your local physician to find out the cause of hair fall, and then the treatment is depending upon what is the cause.
Got it. The next question is how to conceive pregnancy, precautions, tips, when to take the chance, and have more possibility.
Sorry, can you repeat it?
It
I
says
think.
how to conceive, for pregnancy, any precautions or tips that you may have, when to take a chance, and what I believe, it's written what and more possibility. So I believe this person wants to know how is it more possible to conceive. If there's a time specific, thing related there.
Yeah, time specific is, I think you can time your intercourse after, say, 10 days after the start of your menses to around 15 days afterwards. So during that, see, if day one is your first day of the cycle, then from day 10 to the next 10 days, it's advisable that these are the most fertile days during the women's cycle. So having intercourse alternate day does increase the chances of pregnancy. In addition to planning for it, yes, I believe that in this day and age, you should always plan for it. Make sure you visit your gynecologist. You need to be up to date with your vaccinations, because in pregnancy, certain vaccinations you won't be able to take because they are live vaccines. So stay up to date with your vaccination, especially your rubella vaccination should be taken before pregnancy. If you've not had it in your childhood, then you should get your antibody levels checked. You should get your thyroid checked, get your hemoglobin checked. So make sure all of these things are in place, and then you leave it up to God.
Got it. Is it okay to have periods delayed by more than 2 to 3 weeks each month?
Okay, so these they want to know what is the average duration. So the cycle duration, that is difference or gap between each period, varies for every female. Generally, what is considered under the realm of normal period is between 25 to 35 days is what is true for 95% of women. But yes, if you are having periods a cycle that lasts for more than 45 days and less than 21 days, that means if your periods are coming earlier than 3 weeks after the last period and later than 6 weeks, then you definitely need to consult. These are abnormal.
Okay. What is the reason pain on feet every morning, which makes it difficult to walk? However, after a few minutes, the pain seems to subside on its own.
Weak muscles, calcium deficiency, magnesium deficiency, all of them can be the reason. And just ask the patient that initially, when he or she puts the feet on the floor, he should be wearing slippers with some doctor's sole, soft sole, because sometimes in sleep our muscles gets relaxed, and suddenly when the floors of our high rises are also not, they are very hard, they are marble, and sometimes the pain can be just because of the flaccid muscles directly hitting the bone.
Okay. Is it normal having blood clots during periods? Do medicines are important and can lifestyle changes help in period pain and mood disorder? And there's a third following question which says, is
No,
it
no,
normal
we,
to
we
have
take it one by one. I forget.
got it. So is it normal to have blood clots during the period?
Yeah, some of them are normal. Normally, what happens is our this period blood is unclotted blood, that it contains fibrinogen and fibrinolysin. So this is blood that has been clotted and then unclotted. So some of them, if the unclotting enzyme is reduced, and if you're having too much blood at once, then period blood clots are normal. However, if you're having clots all the time, then that means that your bleeding flow is very heavy, and then for that you need to see a doctor. Sometimes it is normal, yes.
Okay. So are medicines important? Can lifestyle changes help in period pain and mood disorder?
See, more than lifestyle changes, I believe that, yeah, getting to the root of the problem, patients who have more underlying stress have more of these symptoms. They have more period pain. So, cognitive behavior therapy, trying to relax, or getting meditation, these have been shown to somewhere. Certain, I think, acupuncture, certain this alternative medicine, especially the Japanese medicine, has shown some benefit in relieving period pain, because most of them is stress related. So in these cases, yet it has shown effect. But in cases that it is severe and debilitating, then medications are always an option. It's not a habit forming medication, and you can easily take it till you are getting things under control, mental wise.
Got it. The next question is it normal if your body temperature is higher during the period?
Yes, it's quite normal, and after menstruation or after ovulation also, in fact, it's a test to detect ovulation in a normal female, that her body temperature rises by zero point 0.5 to 1 degree Celsius after, say, after 14 days after menses, and then it remains elevated for the rest of the cycle. So it's pretty normal.
Okay. The next question is, I don't have thyroid. My face is puffy some days, not every day, especially in the cheek and chin area. This is due to weight or hormonal imbalance.
This could be due to a simple salt retention problem. So get a KFT checked, get a urine routine checked. It could be that you are consuming too much salt. If your thyroid is okay, that means.
Okay. What types of food can increase estrogen level at 50 plus age?
Okay, so certain foods have been shown to have artificial estrogen, like plant estrogens, or rather phytoestrogens that can be there. And foods like seeds, like flax seeds, like sesame seeds, isoflavones, certain foods like black cohosh and nuts, they have been shown to. Soya also, I believe, contains phytoestrogens. So these and all can be consumed to increase natural estrogen levels in your body.
Got it. Deficiency of vitamin B12 and D can be the cause of not conceiving.
Uh, no, that's very unlikely. That's very unlikely. Unless it is also, there is a cause that patient has certain underlying malabsorption disorder like celiac disease, like patient is not able to absorb nutrients. So in that case, the body will be underweight. So underweight definitely is a cause for not conceiving. If the patient is not getting enough nutrition, or obviously the body will not take a challenge as big as pregnancy. So if you're undernourished, yes. So B12 deficiency and vitamin deficiency, that is one of the cause for one of the symptoms of undernourishment. Then yes, that can be one of the cause for not conceiving.
Okay. Following question for the same one is that if we have this deficiency of B12 and vitamin D and we take supplement and it becomes normal, will it be maintained as vegetarian diet is not much rich in these vitamins?
Yes, definitely. In fact, for vitamin D, you need to take a long course up to 8 months with follow diet. And vitamin B12, if you're deficient, it's recommended you to take it regularly, at least 2 months a year, every month, if you are deficient. Because plant sources are very less, even we have to consume it from medication only.
Got it. If someone maintains a balanced diet with vitamin and calcium intake but still experiences bone and muscular health issues, what could be the cause behind this?
Multiple causes can be there, because only calcium, bone is made of multiple things. There is calcium, there is magnesium, there is phosphorus, there is inherent bone strength is low. So as patients, we advise to get for a comprehensive bone panel that includes calcium, phosphorus, magnesium, alkaline phosphatase, as well as a DEXA scan and a PTH level, the hormone that governs the bones. So these can be done to find out exactly what the cause for the bone pain is.
Okay. The next question is sometimes I feel too much of hunger during a period. Sometimes I cannot eat anything and feel like vomiting. Is it normal?
Yeah, it's normal.
Okay. I get blood flow for the first 2 days and third day no flow happens. But again on fourth day the flow starts. Is it normal?
Yeah, that's also pretty normal. It can vary during the course of the cycle.
How to overcome stress to prevent its negative impact on physical health?
So stress has multiple. See, stress, if it is familiar stress, if it is due to family, if it is something that you're not able to tell, if your boss is troubling you and that is causing stress, then obviously that stress needs a different approach than normal stress. If you are stressed despite everything being pretty okay, then that means that you might have some underlying mental health issues. You might have something that needs further probing, and for that, it is recommended that you see a psychologist to really find out what is stressing you so much. If it's an obvious stress, then sometimes talking with a friend, having a confidant, having a good conversation really can help.
Got it. Any other questions anybody has? You can put them in the chat. What steps should be taken or what special care should be given to maintain a healthy, good health for mom after the age of 55?
After the age of 55, most commonly look at your hormones once, get a thyroid checked, get a cardiovascular checkup done, including a blood pressure, a heart evaluation, a blood sugar test, a bone mineral density test, and then supplements like good nutritious protein diet, regular walking, at least 30 to 45 minutes a day. If you can add a resistant training, including a little bit of weight, very good. If not, let it be. Then adding calcium to your diet, at least 500 milligram per day. Any calcium will do, whatever suits you. And getting your vitamin D levels checked and getting replacement. If you're having severe hormonal disbalance, you're having PMS or post-menstrual syndrome, and that can be treated.
All right. Next question. During periods, a flash of blood flow, is that normal?
That's normal because if you are in a different position, if you're changing position, or if you're sleeping, the blood does not have an outlet, then when you change the position, suddenly it comes. That's also normal.
All right. What can be the cause of body not absorbing the minerals and vitamins?
Multiple cause, most commonly it's colitis or duodenitis. You can have a stomach bug, a stomach infection that's not letting you absorb things. You can have allergy to certain things, like a wheat allergy that we see is the most common. Some patients can be allergic to even milk allergy, leading to inflammation in the intestine and not being able to absorb nutrients. Patients can also have malabsorption syndromes, because of which their intestinal lining gets swollen, they're not able to take up the nutrients. Then being sick from other causes also affects, like typhoid and all. It does affect the absorption, and you are not able to really take so much nutrition from your intestine as you should be.
All right. Next question. Any regular health checkup you recommend for hormonal changes?
Yeah, it varies from, yes, but after, say, at least a basic thyroid profile, TSH, a sugar test, then vitamin evaluation and hemoglobin, then a urine routine examination for any infection or for any proteinuria. And if the patient has any specific problems, like if he or she is experiencing hot flashes, then an FSH test will be recommended. If she wants fertility, then a different test will be recommended. Then that depends upon the different, whatever the patient requires.
Got it. Is any type of thyroidism completely curable?
Yes, multiple types actually. So autoimmune thyroiditis, if it is acute, then it is self-limiting and self-resolving in almost 60-70% of the cases. If it is caught early, yes, it's curable. Even hyperthyroidism or Graves' disease, almost 60% we are able to cure with just this antithyroid drugs or tablets taken for around 1 year course. So most of them are curable, but the most common type, that is autoimmune thyroid disease, that is Hashimoto thyroiditis, that has no cure. So the thyroid becomes dead and fibrosed. So in these cases, we do need to give lifelong thyroid hormone replacement.
Got it. Do periods have anything to do with digestion, constipation during periods?
Yes, because the prostaglandins that are released from your uterus, your colon is right next to them. So these are local neurotransmitters, and they can have initially diarrhea, then constipation as well. It's very common to have that.
Got it. Any last questions anybody has? So, Sushmita, we got that very informative session. Thank you so much. Any last questions anybody has? Okay. Okay, guys, so this is the last one that I'm going to take since we have a hard stop at 4 o'clock. Hair is not growing properly, especially in the forehead for the women nowadays. What is the cause? Is this due to stress?
It's seen that it's normally due to something that we call as endocrine disruptors. So this is another huge topic that we see. Our environment pollution right now is polluted by multiple microplastics. They are there in our food, they are there in our diet, they are there in our utensils. So these microplastics or microplastics, small molecules, these are known as endocrine disruptors. So these have a profound effect on our hormonal profile, and they can lead to hair fall. They can have, because there are so many of them, there's no specific test for them as well, and only clean living I can recommend, with some local changes that we can do. But yes, that's most likely the cause that we're seeing right now with the changing hair patterns. Even in children, we're seeing that.
Of course, that has become very common. All right, everybody. So we have now come to the end of the session. Like I said, we have a hard stop at 4 o'clock, so we need to wind this up. Thank you, everybody, for being a part
Thank
of
you,
today's
thank you, thank you.
insightful session. Thank you. We hope this discussion has given you a better understanding of hormones, common disorders, and the practical steps that you can take to maintain hormonal balance and overall wellness. A special thank you to you, Dr. Monika Sharma, for sharing your expertise and guiding us through this important topic. We also extend our gratitude to Akash Hospital for helping us organize this session. All of you have a wonderful Women's Day and stay healthy and stay empowered. Thank you, everybody. Bye bye.
Thank you all.